United States has plunged into panic. In the last several months, the coronavirus pandemic has become a major crisis. Despite unprecedented measures to combat the new coronavirus, attempts to stop the spread of the disease have failed. Communication is massively disrupted all over the world, and borders between states are being closed. People are stocking up on food and other goods and preparing for a long-term quarantine. The situation becomes worse every day. More than 1 million people are infected globally, a number led by America with its almost 300,000 infected and 8,000 dead. Can the world community win the fight against the virus, and was American healthcare ready for it? Towards the end of December 2019, the Chinese government announced the spread of an unknown type of pneumonia in Wuhan. Experts said that the causative agent of this disease was a new type of coronavirus. The Chinese government has launched a decisive campaign against infection. Cities of millions were placed in quarantine, public events were canceled, and the population was obliged not to go out in order to strictly follow sanitary standards. Day by day, entire cities were treated. A prison sentence of 10 years to life imprisonment and the death penalty was imposed for violation of quarantine in China. To combat further spread of the epidemic, Chinese authorities actively used facial recognition systems, which helped identify infected people and establish their social connections. Strong measures allowed China to stay afloat and halt the rapid spread of infection throughout the densely populated country. A decisive factor for Chinese success was the command construction of hospitals for the infected, the first of which was built in just a week and accommodated up to 1,000 patients. Undoubtedly, these immediate actions helped to fight the coronavirus and prevent the country with the world's biggest population from worse consequences. The PRC has now started to distribute medicines all over the world. We should not, however, consider these actions as purely humanitarian. Having surplus demand for medical equipment, Chinese manufacturers seek to slow the inflamed economic crisis, revealing the true motivation for this material aid. Their capitalists, like the rest of the global bourgeois class, primarily seeks to protect their capital, their productivity, and their labor power. Unlike China, European countries were ill-equipped to deal with the spread of the coronavirus infection. In a short time, the number of patients exceeded tens of thousands of people, with Italy having the largest mortality rate. Quarantines were introduced across the European countries. Movements of citizens between countries was restricted, all public institutions were closed, and all public events were cancelled. The quality of medical care and equipment in European countries and the United States is much higher than in other capitalist states due to their heightened concentration of wealth. However, as in other countries, it is sold for profit and thus not available to most. Capitalizing on the robbery of dependent countries, the developed capitalist states can afford the advanced modern technology used to effectively detect coronavirus infection. However, even before the coronavirus outbreak, the majority of Americans believed that the American healthcare system was in crisis. Now that the United States has the highest number of reported coronavirus cases in the world, these problems are on full display. New York alone has more than 70,000 cases and more than 1,000 deaths. There are objective reasons which can be observed for why the capitalist organization of American healthcare has failed to direct a coordinated response to the outbreak. Despite having the most expensive healthcare system in the world, a large proportion of the population is uninsured. The highly privatized nature of American medicine is very profitable, but it is not well equipped to respond to the demands of a public health crisis. A system designed to maximize profits fails to provide adequate medical care to meet society's needs. The institutions that comprise the medical industrial complex are subordinated to the same forces that control other industries, namely the exploitation of workers and the maximization of profit by private capitalists. In the midst of a crisis of basic supplies, the market mechanism encourages individuals to privately stockpile supplies with the intent of profiting through price gouging. Once friendly states are forced to bid against each other in order to obtain the necessary supplies in a war for limited resources. The decentralized, market-driven system of the United States is disorganized, costly, and inefficient in its response. There is a shortage of personal protective equipment for medical workers who are at risk of infection. Ventilators, the most essential tool for the survival of the coronavirus patient, are in dire need in those areas of the United States with the largest number of infected people. Production is predicated on producing a supply of medical equipment that is profitable, not what is needed to deal with the crisis at hand. The epidemic reveals a catastrophic situation in American healthcare. Due to the conditions exacerbated by poor quality medical services, the situation has gone out of control and is now in an unpredictable circumstance. The coronavirus has not created a crisis in the American economy. The overproduction crisis has been slowly developing for months and had been consistently predicted years ago in most long-term financial prospects. The virus panic only spread the crisis worldwide. How has it influenced the American economy? Millions of workers have become unemployed as businesses shut down. According to the latest release from the U.S. Department of Labor, unemployment claims spiked to over 6 million in the week ending March 28th. The reserve army of the unemployed swells as a result of the crisis, and it isn't over. The president of the Federal Reserve Bank of St. Louis, James Bullard, said that the U.S. unemployment rate could reach as high as 30%, or 50 million people, a rate as bad as that of the Great Depression. And while the virus is spreading across the United States, capitalists want workers to die for their profits. JP Morgan had pressured their workers to go back to work, a demand echoed in Trump's early rhetoric, perfectly reflecting their class interests. The Trump administration was warned explicitly about the risk of an infectious disease outbreak, and now that it's here, their blundered response has proven to be a disaster for public health. As we can see, the capitalist economic system has exacerbated the consequences of the coronavirus outbreak. In the 21st century, the progress of science has led to unimagined technological capabilities, and humanity could completely forget about the spread of such epidemics. Despite our incredible capabilities, we continue to see disasters with millions of victims. Billions of people are untouched by modern healthcare, reserved to survive in unsanitary conditions and eat food unsuitable for consumption. Under capitalism, where a small group owns the factories, land, and other productive facilities of modern life, the vast majority have no other choice but to work on their terms. High-quality, affordable healthcare is left out of reach. A thirst for profit and a fear for the loss of their amassed wealth prevents capitalists from taking the early measures necessary to prevent the spread of the disease. And when those measures are finally implemented, it's already too late. Moreover, since capitalists control immense pools of resources, it's easier for them to get through the effects of the epidemic. Even in such a tough situation, capitalists are able to make massive profits. For example, the British media Telegraph states that despite damage to the economy, in the long-term perspective, the virus will have a positive effect, shortening the number of old dependents. Capitalism has proven its inability to deal with problems and challenges the world faces. The only way out is to establish workers' power and build socialism, without which we must question the very survival of mankind. Stay tuned.